a couple folks joining us, but we're going to encourage those in the back to just take a seat, and we're going to get started in about 2 minutes. Thank you.
Vision is by 2028, we will be a 3-site hospital. Our 3-site system will include 3 cornerstone hospitals, Niagara Falls, St. Catharines, and Welland. By the time we get to the 3-site hospital system, patients and families will have access to the highest quality clinicians for aging and wellness, stroke, cardiac, cancer, mental health, and women's and babies. And they will be treated in a very modern healthcare system where we have state-of-the-art equipment, state-of-the-art buildings, which therefore will have best outcomes and best care. Services will be much more connected than they are now because we will have up-to-date infrastructure as well as information systems so that patients and their families' information travels with them.
Culture is what Niagara Health is really made of. It's the opportunity for staff to engage with patients. It's the opportunity for them to engage with each other. Part of my job within our culture department is thinking about the wellness for our staff, the opportunities for them to feel like when they're coming into a building that they're taken care of and so that they can take care of others.
With focusing our resources at these 3 sites, we actually will enable better recruitment of staff, better retention of staff, and most importantly, best outcomes for patients.
I really wanted to become an ally on this project in order to help alleviate some of the fears in the community and start enhancing that conversation in different areas and ensuring that we are looking at the lens of not just process, not just policy, but the personal touch.
I'm glad that I became a patient partner. I'm glad that I was able to get behind the scenes and understand the decision making that Niagara Health makes. Decisions are made with a lot of thought, with a lot of engagement. As a patient partner, I was asked, I was listened to, and I was heard.
We want the region to feel and our staff to feel like we've considered how we can really support best patient care and also support staff to be able to do their best jobs every day.
Quality care is about people, not about a building. The future of healthcare requires access to family doctors and other community-based care providers. The Niagara Health System is working closely with the communities affected by this change to provide new ways to access healthcare.
We are blessed to be able to have these centers of excellence coming to Niagara and ensuring that Niagara is taken care of as a whole.
We don't want to leave our communities to go and get care outside of Niagara region. We want that care right in our own community. So for us to transform the way we're doing right now, we'll take those services, those specialty services, and bring them close to home.
We're going to get the best care possible.
Hi, everybody. Can the people in the back hear me okay? Yes, thank you. Hi, everyone, and thank you so much for joining us to discuss Niagara Health's future plans for hospital services across Niagara region. My name is Lynn Guerrero. I'm the President and CEO of Niagara Health. I am a proud resident of Niagara, and I have spent the last 36 years of my career working in various parts of the healthcare system. I'd like to just take a moment to acknowledge the lens on which we gather. Niagara Health remains committed to highlighting inclusion as a key driver for providing high quality care. We are committed to continue to listen and learn more about the history and current experiences of Indigenous peoples, and I acknowledge my own responsibility to take meaningful action towards reconciliation in the healthcare system. One way I've continued my own journey of learning and reconciliation is to support the development of our first Indigenous Health and Reconciliation Strategic Plan, which was created with input from many leaders from the Indigenous community across Niagara and was created by our newly formed Indigenous Health and Reconciliation team at Niagara Health. The plan will be launched in the coming weeks. So my hope for this evening is that we get into a great dialogue and we look forward to taking your ideas and your questions and your concerns, answering as many as we can tonight, and for those we can't answer, getting back to you at a later time. Our plan to build a 3-site hospital model has actually been in the works for a very long time. And we're really lucky that we didn't lose any momentum during the pandemic like many of my colleagues did. We really made sure that the planning of the capital team for the South Niagara site kept going throughout the pandemic, as well as our capital team planning for what would occur at the Welland site. I'm joined by some colleagues on stage that I'd like to introduce you to. Angela Zagneri, Executive Vice President, Finance, Redevelopment and Facilities and Chief Financial Officer. Heather Patterson, Executive Vice President, Clinical Operations. And Dr. Satish Chawla, Interim Chief of Staff and Executive Vice President of Medical Affairs. The rest of the executive team of Niagara Health is here in the audience, as well as many of our board members. I also want to thank some of our partners for being here. So we have some members of the Niagara Ontario Health team here this evening, and some of our primary care providers from the community. This is the 5th of many community engagement sessions that we have planned over the coming weeks as we continue to plan for the 3-site hospital system here in Niagara. We're really fortunate in Niagara to be building a second brand new hospital in Niagara Falls, a mere 10 years after the opening of the new site in St. Catharines. And that is a little unheard of in the province of Ontario, I have to tell you, to be getting 2 new hospitals in the same region over that short period of time. As well, we are in discussions and have been for quite a long time with the Ontario government on a significant redevelopment at the current Welland site. And we are waiting on a planning grant from them to actually dig a little deeper in some of the planning work for that site so that we don't lose any momentum. The Welland site is a critical part of the 3-site model, so we have to be well on our way before the South Niagara site opens. One of the good things about taking on projects of this size is that it really forces us to think about how we are currently delivering care and how we need to deliver care in the future with a new hospital being built. And that's why we are here tonight. So this model has been in the planning for 10 years already, but I want to remind everybody that we're actually still 5 years away. So the new South site is scheduled to open in 2028. We've been working quite hard with municipalities across the Niagara region, as well as the provincial government and our healthcare partners in the region, to look at how we're going to provide high quality care to residents across Niagara as we work to modernize our hospital system. And that is a critical part of delivering high quality care. We must be modernizing our buildings, our teams, and our way of delivering services to keep up with technology and quality care for our patients. So we're here today because we want to hear your thoughts. We want to get your input as we work with the municipalities and continue to have those conversations. We want to have the conversations with members of the community. And I really want to have a productive conversation, and the beauty of the session here in Welland is that we still have lots of planning to do for the site here in Welland, and so taking your input will have a really big impact on what we do with the site writ large, not just for hospital services, but what else might be a good use for the site. So before we jump into the presentation further, I just want to pass things over to our moderator, Carly Ellis, who will provide a bit of an overview of today's session. Over to you, Carly.
Hi everyone, welcome. Thanks so much for being here this evening. As Lynn mentioned, my name is Carly Ellis and I'm here to help moderate today's session as well as our question and answer period. We started at 6:30 sharp today, which is fantastic, thank you, and we're hoping to conclude today's session around 8 p.m. For our agenda today, we're going to start with a presentation on our plans for a regional hospital system here in Niagara. We will then proceed to a question and answer period where we're really looking to hear from you. We ask that you do please save your questions until the end of the presentation. We're hoping to have about 45 minutes for questions and answers, so we hope to be able to get to all of you. Many of you actually submitted questions in advance, and we actually hope that our presentation will cover some of those questions that you submitted to us. When we do proceed to the question and answer period, we ask that you ask only one question at a time, so we can get to as many questions as possible. You may have also noticed as you were coming in that some of our staff were encouraging you to leave some ideas around the future of the hospital system here in Niagara, specifically in Welland. So at the back of the room, you'll see there's some posters and some sticky notes. So before you leave today, we really would encourage you to leave your ideas behind. We're going to collect those and they're going to be inputted into the plans for the future. In addition, if we are not able to get to your question today, we do have cue cards where you're able to write down the question that we did not get to, and we're going to be posting a summary of tonight's session, as well as answering any questions that we don't get to, and we'll be posting a summary of that online. We do have a couple of rules that we'd like to go over for today, as we would like to have a really productive conversation. So first of all, we would really ask that you maintain respect for this space. It's a beautiful space that we have here today, and that you respect those others in the room. We ask that you please don't do anything that might prevent others from hearing whoever is speaking or cause any other unnecessary distractions. We ask that you ask only one question at a time, and that you please raise your hand, and a facilitator on the floor will bring you a microphone. Before asking your question, we do request that you say your first and last name, and I will announce the last question when our time is up. We also wanted to note that today's presentation is being live streamed. So if you have some friends and family that weren't able to make it today, they'll be able to see this online. I'm now going to pass this back to Lynn, and we ask that you hold your questions until the end of the presentation. Thank you.
Thanks, Carly. Okay. So just to start off, it's important to acknowledge that we believe every person in the region deserves to live every day of their life in the best health possible. As a community hospital system, it's really important for us to acknowledge that our focus on teaching and learning, research, innovation, and partnerships continually moves us to propel and improve care. So we provide care, but we do a lot in the background to make sure that we are always providing the best evidence-based care, and to make sure that we're actually making a positive difference in people's lives. So the 2023 Niagara Health strategic plan is rooted on you, our patients, and the members of the community. Central to the plan is designing a hospital system around the needs of our patients, their families, and loved ones, as well designing a hospital system that works for our incredible teams that deliver the care. Our goal is for it to be easier for you to access high quality hospital services and to improve your experience. So this is an important picture. It's really essential to recognize that hospitals are but one piece of a very complicated healthcare puzzle. And for those of you who've ever had to navigate the healthcare system, it is very confusing and complicated at times. So that's why it's essential that we work with our partners to deliver seamless care across various parts of the system. And that includes primary care, which you'll see here colored a bit differently because we want to emphasize that. Primary care means your family doctor, but also the teams that work with your family doctor. Home care, long-term care, emergency medical services, public health, and community health centers. So it's a pretty vast array of health services that are available. So in order to deliver patient-centered, high-quality care, all of these pieces need to fit together seamlessly. And we just want to be, emphasizing that high-quality care isn't about just one thing. It's about the entire system, and it's really built on partnerships because it's essential that all of these parts work together. So that's really important as we look at some of the external pressures that we are facing now, such as a shortage of family doctors, which impacts all of us with our healthcare, but impacts the rest of the healthcare system. A shortage of long-term care beds across the entire province, and we're feeling those pressures here in Niagara. And a shortage of healthcare workers pretty much across the whole spectrum of people who provide healthcare services. We also want to talk a little bit about types of care, because as we've gone on some of these engagement sessions, we've really noticed that there's a bit of a knowledge gap on some of the phrases we use in healthcare. So when we talk about primary care, access to family doctors and other primary care providers is absolutely essential to having a high quality healthcare system. And I cannot emphasize that enough. The research is very clear that access to comprehensive team-based primary care, so not just a family doctor alone, but team-based primary care, available to you when you are ill, is the foundation of a high-performing health system. And that's true across the world. There's a great article by Jane Philpott in today's media, if you've seen it, about what we used to call the medical home, but she's rephrased it into the primary care home, which I loved. But it is that notion that everyone deserves and must have in a publicly funded healthcare system. They must be attached to a primary care group. That's their home for their medical services. I just want to also acknowledge that comprehensive team-based care is more than just strictly seeing a doctor when you're sick. So it's a whole team of professionals, including your family doctor, but professionals such as nurses, nurse practitioners, dietitians, mental health workers, and many others who assist you in staying well and to proactively manage long-term illnesses or chronic conditions you have. So absolutely you need access to a primary care provider when you're sick, but it's better to be connected to a team to keep you healthy. So they do things like cancer screenings, they manage your medications, they conduct well baby checkups. The list is quite long, if those of you who are connected to a team will know. And that is what Ontarians deserve, because we know that that's the best health care possible. We also know, though, that Niagara region is underserviced for primary care, and in fact, the whole province right now is underserviced for primary care. So we've been working very hard with our healthcare partners, the provincial government, and very specifically with the mayors of the municipalities in Niagara to expand access to primary care teams within the region. So why are we evolving? So there's a few reasons. I'm going to go over, I think, 4 of them here. First of all, our population is growing, but it's also becoming more complex as our population ages. So the great thing is people are living longer, but when you do that, you tend to live with more chronic conditions. So managing healthcare for our population is becoming more and more complicated. And this is creating great pressures on our hospital system. As a result, we are one of the busiest emergency departments in the region, actually, in the Hamilton, Alderman, Niagara, Brant, whatever our region is called, that region. We are one of the busiest emergency departments, if not the busiest emergency department. And we do provide the highest number of day surgeries in that same region. So Niagara Health as a hospital system has grown significantly when you look at the variable of the number of patients we've been serving. The second issue, team shortages. So like hospitals across the province and across the country, we're facing shortages of healthcare workers across all of our teams, but we're probably feeling this the most in those who are trained to work in emergency departments and in our operating rooms. So we have over 400 staff vacancies at the moment. We are having particular challenges in recruiting nurses, personal support workers, and medical imaging technologists. And these shortages reach across all areas of the hospital, not just one program. This number does not account for physician shortages. Our physician shortages include physicians trained in emergency medicine, anesthesiologists, and general internal medicine physicians. So we're doing everything we can to recruit new staff and physicians. We filled over 2,500 positions between April and December of last year. So that's 2,500 positions filled in an 8-month period. So our teams are doing amazing work on recruiting additional people, but that work is constantly churning. So we know that we're dealing with this challenge now. There really isn't a short-term solution with healthcare worker shortages in the next year. So we will be dealing with this challenge for years to come. So it does mean that we have to have other models of care, and we have to keep up with the challenges by changing the way we work. The next is a little bit about disconnected care. So we really do need to evolve to create a more connected, organized care model. We need to better organize our services around the patient. And it might surprise you to know that Niagara Health is still using paper records and outdated electronic systems. And this will be changed in September when we launch our new hospital information system. It's critical to do this because a modernized health information system increases quality of care, increases patient safety, increases the efficiency of our teams working. So when you're working with a shortage, you really need to make those teams efficient. So this is a massive change initiative that we're undertaking, and we have to get it done well before the new hospital opens to make sure it's working perfectly. We also lack some specialty care at some of our sites, and often residents are confused about where to go for their different healthcare needs, and we really do want to take that confusion away. Our staff and physicians are also requesting a better connected system. So this is not just for patients, it's also for our teams. We're positive that moving to a more modern health information system, as well as moving to a 3-site model of modern facilities, will go a long way in creating that more connected system. So next is outdated infrastructure. Our sites in Port Colborne, Fort Erie, and Niagara Falls are quite old, and frankly, they are beyond the point of renovation to meet the future healthcare needs of what medicine and healthcare look like in the future. The site at Welland requires major renovations and updates. And for those of you who've been to any of those sites, you will agree that when you go to those sites, it does feel like there needs to be a lot of work on those buildings. So that's why this plan has been so long in the making. So it is incredibly important that we bring those facilities into the 21st century. And the new South Niagara Hospital obviously will go a long way to helping with this plan. And finally, limited physical capacity. So we have literally run out of room at Niagara Health. And if you've been to one of our sites recently, you will feel it. We're operating pretty much every day well beyond our current physical capacity. Our occupancy rate is often at about 115%, and our emergency departments are overcrowded as a result. Because if our patients who are in our emerge need an inpatient bed, but the inpatient beds are full, then those people end up waiting in the emerge to get a bed. And so that's why we end up with overcrowding, which is not a safe environment for patients. So at times, we've had over 100 patients admitted in our emergency departments, but without a bed to go to. So we really need to make sure we are evolving to build new space, increase space, so that we can accommodate this growing and aging population of people that come to us for service. So the time to change and to move forward with this is now, and we're really lucky that we have a plan to get us there, and it's been more than a decade in the making, so we're really confident that this is the right plan. I am going to now turn it over to Angela to continue.
Thanks, Lynn. And hello, everyone. My name is Angela Zangari, and I'm the Executive Vice President for Finance, Redevelopment, Facilities, and the Chief Financial Officer here at Niagara Health. I've lived my whole life here in Niagara. I'm a resident of Thorold, and I've worked at Niagara Health for almost 33 years now. So we've been making great progress on our plan to transform how we deliver care, and we're moving towards a model that will benefit all of the Niagara residents, no matter where they live in the region. And in order to provide the best quality of care to our patients, we need to focus those limited resources that Lynn referred to, so our limited resources from a capacity perspective, but also human resources, our staff, and our physicians as well, and build seamless hospital care across Niagara with 3 cornerstone hospitals. the Murata Family Hospital, which was previously the St. Catharines Hospital, the new South Niagara Hospital, and the Welland Hospital. So these 3 sites will provide our patients access to the highest quality of care, bringing together our staffing and our expertise together. We're well on our way to that journey and achieving our vision to replace the outdated and outgrown infrastructure with modern hospitals that will enable us to deliver a truly connected care for communities across Niagara. We do anticipate that services will transition to these 3-site models in 2028, so we do have a bit of time to go, so about another 5 years to prepare. Our future vision. So in addition, the system will provide access to specialized care in areas including mental health and addictions, cardiac, kidneys, stroke, cancer, complex care, wellness and aging, eye care, and maternity care. And while different sites will have their own areas of expertise, all 3 hospitals will work together as part of that seamless system of care. So what this means is that as a patient, you'll be able to go to any of the Niagara Health sites, and even if that site doesn't offer the services that you need, you'll be quickly transferred to the site that does. So in essence, there will be no wrong door. The future must also include, as Lynn mentioned, strong primary and community care that's led by our Ontario Health team and community-based health partners. So what do these changes mean for our patients, our communities, our physicians, and our staff? Our patients and families will be able to access more care and services in Niagara with state-of-the-art facilities that have modern technology, private rooms, more beds, and services. By building a modern and connected hospital system, patients and their caregivers will be able to move seamlessly between services within our region. And transforming our hospitals and how we deliver care means patients will receive better access to hospital services and specialized care from the best of the clinical experts. Everyone in Niagara knows the Walker Family Cancer Centre is where to access the best cancer care in the region. Each of our 3 future sites will have similarly specialized programs that will offer the best of the best our local healthcare has to offer. By building a new and modern hospital system, it will help us to recruit and retain more expert doctors, nurses, and staff right here in Niagara. And this also means providing more staff to our patients, which is what we're here for. Bringing together our teams creates collaborative and supportive environments that we have already witnessed in the Murata Family Hospital with our Women's and Babies Unit, and in Welland with our eye care specialization, and Niagara Falls, our stroke care center. I really want to emphasize that quality healthcare is more than about the physical buildings. It's about access to modern equipment, highly trained staff, and physicians. So where are we on the process to building this seamless hospital system? We're about halfway there. The St. Catharines Hospital, now Murata Family Hospital, the first of our cornerstone hospitals, was completed in 2013. We just broke ground last summer on the new South Niagara Hospital. And finally, we'll be redeveloping the Welland site pending confirmation of a capital planning grant from the province. Our plan is for Welland to provide 24/7 emergency services, various outpatient programs, mental health and addictions, and complex care. So by the end of this process, we'll have 3 modern hospitals that will be Niagara Health. The South Niagara Hospital will transform the way that we're delivering care. Niagara Health and our partners are creating a more modern and coordinated system of care that is centered on patients and caregivers. The South Niagara Hospital will have 469 beds, increasing the regional capacity by an additional 156 beds. It will offer a full scope of hospital services as well as centers of excellence in complex care, wellness and aging, and stroke. It'll also provide a 74% more capacity for MRI tests, accommodate 7,400 more seniors wellness visits, and include 12 additional hemodialysis stations. The South Niagara Hospital will also be approximately 10 minutes closer to the Welland Hospital than the current Niagara Falls Hospital is. In addition to having access to care at the Welland Hospital, patients in Welland will be able to access those specialized services at the new South Niagara Hospital. The Murata Family Hospital, which opened in 2013, is a great example of the success that we had when we focused our resources and brought together the most experienced experts in one building. I talked about the Walker Family Cancer Center, but we also have the Women's and Babies Unit, Heart Investigation Unit, and Mental Health and Addictions programs. Those are great examples of the enhanced level of expertise that we can provide when we consolidate certain services. So the Welland Hospital. The Welland Hospital is and will continue to be a critical part of Niagara Health's plan to transform care. It's exciting to imagine that the Welland Hospital will become what it will become once it's redeveloped. The changes in Welland will happen in phases and will provide plenty of opportunity for Niagara Health and the community to work together to reimagine the entire site, not just the hospital and long-term care home. Based on the approved plans for the Murata Family and South Niagara Hospital, our vision is that Welland will have 24/7 emergency services with 8 to 10 observation beds, have a long list of outpatient clinics, diagnostic imaging, so things like CAT scan, ultrasound, x-ray, kidney care, a center of excellence in eye care, and become the administrative hub for our teams. The Newport Center, currently at the Port Colborne site, which is a provincial residential addictions treatment center, is also planned to be moved from the Port Colborne site to the Welland Hospital site. Our plan includes expanding our eye care program at Welland so that more patients can get their much needed eye procedures like cataract surgeries. Between April of 2022 and March of 2023, our eye care specialists performed 6,698 cataract surgeries. With a redeveloped Welland Hospital, patients will be able to access their care and emergency services in a renovated space that is new and modern. Further staff and community engagement is required to submit a proposal to the Ministry of Health for the Welland Hospital site as well. Ontario Health is fully aware of the need to redevelop our current Welland Hospital site, and we are actively working with the provincial government towards securing necessary approvals. So as I mentioned, there's a lot of opportunity at the Welland site, and we're looking forward to putting it to the best use possible to serve our communities. So based on the needs of the Niagara population, specifically the large number of seniors with chronic conditions, the site will be a seniors-focused campus of care. This includes complex care beds, which are intended for people with chronic conditions, slow rehabilitation, transitional beds for individuals waiting for long-term care or home care services, and palliative care beds. We are also incredibly proud of our long-term care home in Welland. And currently the long-term care home, much like the Welland Hospital, is outdated and requires redevelopment to meet the future need of the residents. In March of 2021, the Ontario government announced that the 40 interim beds that we were operating would become permanent and approved an additional 13 beds, bringing the total to 128 beds. We continue to work very closely with the Ministry of Health, Ministry of Long-Term Care to determine how best to rebuild the home and to add much more needed long-term care beds to the region. The funding process to build a new long-term care home is much different from building a hospital, but we are working together with the government as the facility requires much needed upgrades. So we have an amazing opportunity in Welland given the immense size of the land at the site. And together we can build a campus at the Welland site that is more than a hospital. The hospital itself cannot provide everything. With help from our partners, a redeveloped site can include preventative care by our community health partners, such as nutrition classes, art classes, our exercise classes, a family health team, an academic and teaching campus for Niagara College, Brock University, McMaster University, and Trillium College. An unused land could be developed by a community partner for senior supportive housing. There could be an elevated transit hub, Indigenous and spiritual healing spaces, or even a community garden. All to say that there is a lot of opportunity for the Welland site, and we have an opportunity to create something truly special together. Thank you. I'm going to turn it over to Lynn.
So we're obviously, as you can tell, very excited about this model moving forward. And following the opening of the new South Niagara Hospital, all hospital programs and services that have been operated by Niagara Health will be transitioned from Fort Erie and Port Colborne sites, as well as the current Niagara Falls site, to the South Niagara and the Welland hospitals. And by bringing together our limited resources, the three hospitals will be able to offer more specialized care to patients by the best clinical experts who are now going to be working in cohesive teams. As mentioned extensively by Angela, the plan is to redevelop the Welland Hospital on that same site. And it is and continues to be a cornerstone of this model. And we're committed to not only keeping it in the community, but redeveloping it for the future and really making it an amazing place. We're really excited about the opportunities to add more to that site other than just hospital services, as you can tell. The new South Niagara Hospital also will increase our emergency department capacity for the region substantially, which we're really excited about. It's going to be about triple the size of the current Niagara Falls Emerge, and it will be able to accommodate approximately double the number of patients every day than the current Niagara Falls site. Following the opening of the new South Niagara Hospital in 2028, it's hope that the municipalities in those areas will determine how to best use those sites. So the current site in Niagara Falls, Port Colborne, and Fort Erie, for the benefit of those communities. We've been working quite closely with the municipalities and the mayors to figure out a plan, and we'll continue to support them to do that. We would love it, and I think the mayors would also love it, if those sites could continue to be used for various health services, like primary care teams, diagnostic imaging, and the like. So we're working very closely with those mayors to determine the use of these sites. But Niagara Health will no longer be operating any services out of Port Colborne and Fort Erie sites after the transition. So we're ready to start the Q&A. I'm going to ask Carly to come back. Okay, thanks. Yeah.
Thanks so much, Lynn. I think we're okay. I think we're okay. If we all go down. So first of all, I did just want to mention, although this is a very beautiful facility, I realized there was a lot of sunlight coming in during the presentation. So some folks were having a bit of a hard time seeing the slides. We're actually going to post the slides online after the presentation, so if folks want to take a review through, you'll have an opportunity. So sorry about that. Hopefully you were able to get most of the messaging from the speaking remarks that Lynn and Angela shared with us today. So with that, as I mentioned earlier, we did have some questions that came in advance of today's presentation. So we have a couple pre-submitted questions we're going to go through, and then we'll turn over to the live Q&A. So to start with, one of the questions we received in advance of tonight's session: will there be inpatient beds and an intensive care unit when redevelopment of the Welland Hospital is complete?
Thank you for the question. I can start off with saying, and I hope that you got that from the presentation that I made, that Welland will still continue to be a significant hospital within Niagara Health. It's one of our major cornerstone hospitals. So I'm hoping I made that clear in the presentation. So Welland, the site will have complex care beds. It'll have 24/7 emergency services. It'll have 8 to 10 observation beds. It'll have a wide range of diagnostic services, so things like your labs, your CAT scans, your ultrasounds, your x-rays. What it won't have is the inpatient beds or a critical care unit or ICU. So pending the, once the South Niagara Hospital opens, and based on the plans for the Murata Family Hospital and the South Niagara Hospital and our whole campus of care planning, and again, referring back to those limited resources that we have, the Welland Hospital will not have those inpatient medical surgical beds or the critical care ICU beds. But we will have a significant amount of clinics. It will have all of our diagnostics. It'll have our complex care beds, the 24/7 emergency, and our 8 to 10 observation beds will still remain in the Welland Hospital. So it'll still be a significant footprint for Welland. But I also want to just reiterate too about some things we know. So the complex care beds, the emergency services, things that are staying. What we don't know and what we want to have as far as input from the community is what other services does the community need and want. So what type of specialized clinics, what mental health and addictions clinics do we need? What other types of outpatient type of potential surgeries that we could do there? We have the eye center that will be for the entire region, continue to be held at the Welland Hospital site as well. So again, significant, but no inpatient beds.
Thanks, Angela. And as Angela mentioned in the presentation as well, there's going to be more opportunities for engagement. But for this evening, we are starting some engagement, and at the back of the room, there's some posters and an opportunity to leave your ideas on some sticky notes there as a starting point for our engagement on the future of the Welland site as well. The next question that we received: will there be opportunities for community members to get involved in the planning for the redeveloped Welland site? And I believe we actually have one of our patient partners, Jim, here today. So I'm going to turn it over to him to provide a first bit of an answer, and then over to the leadership team.
Thanks, Carly, and welcome everyone. My name is Jim Briscoe. I'm the Executive Director at the Welland Master Family Health Team, and I'm also a patient partner. I've been a patient partner at the Niagara Health System since 2021. I chose to be a patient partner after I've had a lived experience at Niagara Health with some heart issues I had. So all the way from the experience I had with my cardiologist all the way to Niagara Health was a very good experience. And I know as an executive director in a healthcare team, one of those partners that Lynn mentioned that are in our communities, we don't all have great experiences when we experience Niagara Health. So I wanted to become a patient partner because I wanted to make sure the patient voice was heard, the partner voice were heard in the community as we embark on this, this is the redevelopment of our health system. The experiences I've had so far as a patient partner have been very impressive. The engagement that Niagara Health has listened to us as patients in their development stages has been very impressive, and I'm very confident going into the future that Niagara Health will continue. So the short answer to the question is I would say yes, it has to be. It has to be, we have to be listened to as partners and community members for this development to be successful and for our health system to be here for our children and our grandchildren in the future. So thank you for this opportunity to answer that question. And again, as a patient partner, I'm trying to hold Niagara Health accountable for the decisions they make and make sure they make the right decisions for our communities. Thank you.
Thanks so much, Jim. And did anyone on the leadership team want to add to Jim's answer about engagement opportunities moving forward?
Sure. Just to reiterate, absolutely. We'll be looking. I think we already started as far as trying to get some input. So I know there's some cards back there. So absolutely, if you have any input as far as future services for Welland, please feel free to jot those down, or if you'd like to be considered as far as part of any groups going forward from a community engagement perspective, please put down any of your contact information as well.
Perfect. There's lots of folks around the room with name tags, so if you are interested in being involved further, you can just grab one of us and we'll be sure to take your contact information. The next question that was submitted in advance of tonight's session: will Niagara Health reinstate after-hours emergency surgeries at the Welland Hospital?
Thanks, Carly. I can take that question. So in February of 2023, the Niagara Health had to make the difficult decision to share resources with our Niagara General Hospital, and with an anesthesia shortage, which was critical to us and similar to what other organizations experience across the province. We made a difficult decision to only operate day surgery cases at the Welland site, and all after-hours surgeries and on weekends went to our Niagara Falls site. We continue to experience HHR challenges in our surgical program. We are aggressively recruiting for anesthetists, and we have made some really good strides, but still continue to struggle with the HHR resource, not just with anesthesiologists, but with nurses as well. So at this point, our plan will stay the same. But what I think is important for our residents of Welland to understand is that our day surgery cases that we perform at the Welland site are elective hip replacements or knee replacements, and also our cataracts. Those three procedures are the highest volume of procedures that we do across the Niagara Health with respect to our elective surgeries. And it was really important for us to be able to consolidate those services in order for us to maintain service and our commitment to the residents of the Niagara region for this really high volume, for the high volume of surgeries that we do. Thank you.
Okay, so that